Welcome to the Possibility Action Network podcast. I'm your host, Stephen Middleton, aka Possibilityman. We are committed to bringing you guests who strive to better people's lives and serve as a force for good in the world. Our guest today is Dr. Rita Armstrong. She has been in healthcare and nursing education for over 2 decades. She started her career as a medical assistant. Inspired by the nursing profession, she continued her education, culminating in the Doctorate in Nursing Practice. She has been a professor and dean and a mentor to students numbering in the thousands. She is the founder and CEO of Nursing U Educational Resources. Dr. Armstrong, welcome to the show today.
Thank you for having me, Dr. Middleton. I'm excited to be here.
Well, look, I have a ton of questions to ask you, but first, this reminder to our listeners and our viewers, your support matters. Follow, like, and share this podcast wherever you find it. Dr. Armstrong, you have gone quite far from being a medical assistant back in San Antonio. Wow.
Yes, I have.
Look, why did you choose nursing? In fact, if you can go back to when you applied for that job as a medical assistant, what prompted you to pick that particular job?
What prompted me, initially, I basically wanted to help individuals with whatever the issue was, right? From a health perspective. But as a medical assistant, I felt limited to either, I was working actually at a minor emergency family practice clinic at the time, and also, laboratory environments, as a phlebotomist. So I still felt limited as far as how much of my skill set and knowledge and expertise I could give to the community, to the healthcare community. So that's one of the reasons that actually prompted me to go a little bit further and beyond just medical assistant.
I see. Now, you not only went farther, you went way beyond. So why did you continue? Bachelor's, master's, and doctorate. Why continue?
I will say this,
Uh-huh.
and not to offend anyone, but first and foremost, I am a Christian. Okay. And I understand that when doors open for me, the path that I have in front of me, that is one of the things that I take seriously. And I go with it. I can say for the most part, my mom, she was an ICU nurse for over 40 some odd years. And while she worked, just about her entire life, I can say that did kind of spark me, her profession. And, back then, of course, they still wore, the white uniforms, they still wore the white nursing caps. And so that showed a profession, that showed professionalism, that showed a pillar in the community. And so I was like, you know what, that's something I think I want to do. And once I got into it, I said, well, how can I best serve the public? A lot of people. And nursing was definitely it. It comes with a lot. But I started off with my LPN back in Texas, and that program was actually a year. But once I finished that, I thought I was done. I really did, because I was one of those that was like, okay, I just want to get my nursing license and that's it. But once the door really opened and I saw what the possibilities were, the challenges, the changes I could make, being a change agent within the profession, that sparked me. And so I just kept going. I just kept going. I moved forward, on to getting my RN at St. Philip's College in San Antonio. And once I finished that, I was like, okay, what else can I do now? Because with that knowledge, with that education, it prepares you to be a lifelong learner. It really does, because I wanted more. I felt like, okay, I'm here. I have my license as a registered nurse, but I still feel like I was missing something. And so I was.
Yeah, I see. But we're glad you continued. Now, you mentioned your mother working in an ICU. I could see how that could have sparked something in you, because many of us growing up didn't have that type of role model in our household. Yeah.
Right.
Yeah.
I can say for those that didn't, and I think that's what the other piece was that was missing for me, because not only was I a registered nurse, and providing, quality care to patients, I also had the opportunity to change other individuals who wanted to be a nurse as well.
Mhm, mhm.
And so,
So, mhm.
Mhm.
Yes, please continue that statement. Mhm.
No, and so basically that's what prompted me to move on in my education, on a master's level. I did go get my bachelor's, and from the bachelor's, it was okay, but I still felt like the doors weren't truly open yet. So I did go back and get my master's, but my concentration was in nursing education itself. Because what I saw over the years as I was obtaining my education, the face of education in nursing was changing also. And so
Mhm.
just like the healthcare changes, right, from
Mhm.
year to year or month to month, or the same thing with the education component.
Okay.
And so I
So,
felt like at that
mhm.
time, yes, that
Yeah.
master I
So,
needed.
yeah. So, did you fall in love with nursing as a medical assistant, or did you fall in nursing later on? Do you recall when you knew that I love this?
I knew, or I fell in love with it once I had gotten my RN, my registered nursing license,
Mhm.
because the responsibility of an RN is different from an LPN. While we are still both nurses, the level um, of responsibility and accountability is more. And not
Mhm.
only that, what you have to put into it is so much more. Once I had gotten the epiphany to go into nursing education, the education side of it, that's when I fell in love with nursing. Now,
Mhm.
don't get me wrong, as a bedside nurse, yes, I loved working my units. I was even a charge nurse, but when it came to the actual delivery of how do you teach someone to do this, because the job
Mhm.
was hard. The job is hard. Being a nurse is hard, but
Mhm.
it takes a certain skill set, a certain knowledge, a certain expertise in order to deliver this information to someone who has no background at all. And so
Mhm.
that's when I actually fell in love after I got my master's in nursing education.
Uh-huh. Now you have a few, specialties that that you claim, including geriatrics, ortho-rehab, surgical nursing. Why these fields? These seem to be very challenging areas to specialize in. Why did you pick them?
Because it gives you a very diverse population of patients.
Mm,
We see just about any and everything, on the med surg unit. And it makes you really well-rounded to where if you needed to go and work a more specialized unit, you'd be able to.
mhm,
I did find it difficult for some nurses that came from a specialty unit to try to come and work a med surg unit. It was a little
mhm,
bit difficult because they haven't dealt with those type of patients, with those different complexities and things like that. And the med-surg unit is very fast-paced. It's a very fast-paced unit. And you really do have to know what you're doing and be able to prioritize your care and still be able to maintain that level of quality, as it
mhm,
pertains to patient care.
mhm. Yeah, help us seize, because we are the consumers, of what nurses and medical doctors provide. But let's take us into a surgical room. The patient has been put under, something is going on. What is that like to see a body there and the doctor and the nurses are working on that body? What is that like?
I can tell you the adrenaline is definitely definitely there. It's
Mhm,
like you go into superhero mode,
mhm.
if I can just put it lightly.
Sure.
And then you're thinking on your feet, because you know this information, you know what you need to do in terms of saving a life. Now the outcome may not always be positive, in saving
Mhm,
someone's life, but in knowing what to do and how to do, and then you're working collaboratively with let's say the emergency room physician, another nurse from another unit, et
mhm,
cetera. And so because of that, then you have this team that you're working with, but everyone has a role, everyone has a position. So for you to be able to, how can I say, maintain that in that moment and do what you need to do, that's awesome. I mean, it's, for me, it's a rush.
Yeah.
Rush to
Okay.
be able
So
to do that. But
yeah.
my main
So
goal is to ensure safety, number one, not just for the patient, but for those that are around me as well. Because if you're thinking about a room and you're thinking about the code team and you, that's a lot of people in one room, and it can get very chaotic and it can get very stressful because the stress levels are high, the anxiety's high. And then especially if you're dealing with family members. So it can really be, how can I say, a very chaotic moment in time. Whether it's 5 minutes, 10 minutes, or 15 minutes, however long that code is going on. But yeah.
Okay, so Dr. Armstrong, what is it like to save a person's life? What is that like?
I can't even put words to it. Because as I take care of clients, and I have been in a position where I've had to administer CPR on many occasions, you start thinking about your loved ones, you, for instance, if that was you laying there, would the person, do their best, their utmost best, to ensure that you are going to survive this. There's a lot of things that come with that, though. There's the patient's history, where they're at physically, their age even, that may determine the outcome of whether the life is saved or not. I can say that it does put you in a place to humble you. You know what I'm saying? Because in knowing that, yes, you did save this person's life, you contributed to that, that's very humbling. Because it really could have went the other way. And even if you don't have that opportunity, or that person didn't make it, it's still a humbling experience.
Yeah.
You can't beat yourself up about it, because I know when I was a new nurse, back when I was an LPN and we were in coded situations, it was to where, I would go home and I was like, what else could we have done, to save this person? And as the more education I sought after, and the training, and, going to that next level of being a registered nurse, it really is about doing your best each and every time you step foot into the facility and dealing with patients, regardless of what the outcome is. If you can go home at the end of the day and said, I did everything that I needed to do to the best of my ability, that's going to help you sleep at night. Because there are situations where you'll go home and you'll beat yourself up and you'll be like, well, you know what, that totally could have went another way, or that could have went another direction.
Yeah, I'm glad you said that. I'm going to ask a follow-up question, because some of our viewers and listeners may think, if a family member, departs this earth in the hospital, they may feel they're hurt. But what we may not always recognize is that the medical team who was working on this person may also hurt. Is that true? What's the feeling when a person didn't make it? What's that like for a nursing professional?
I can say, I can only speak for myself on that. I can't speak for any other professional as far as their walk, their journey within the profession. But for me, I have to reflect daily, in order to make improvements, in order to improve within myself, as a professional. It's not easy, because a lot of times, when you're on the inside of things and you're on the inside doing things, it gets to a point to where you don't really see, and until it's brought to your attention, to that degree. But for the most part, I do reflect quite a bit.
Yeah. Now, you mentioned that you are a person of faith. As a person of faith, working on helping a person who is sick get better, Does it make your faith stronger? How does that affect a person's faith, if it does in any way?
It definitely strengthens my faith in that regard. And I can tell you that I have been challenged quite a bit. And not just with, my nursing practice, but just as an individual, But when it comes to what I do now in the field, and also what I'm helping others to do, oh yeah, my faith is certainly challenged, but it doesn't waver.
Yeah, that's great. Yeah. So, in working as a nurse, you also work with nursing students. If you were counseling, let's say a group of students who are in an associate's degree program, and they're asking the question, is nursing a field for me? What kinds of things would you ask them to consider in evaluating their readiness to enter a nursing program?
One of the biggest things I ask them is their commitment. Where is their commitment in wanting to come into this profession? Because it is a commitment. I'm pretty sure that you've, read some of the news as it pertains to, nurses leaving the profession as soon as they come into it, things of that nature. And you really do have to have a level of commitment to be able to do this, because it's not for everybody. It really is not. And not only that, integrity is another question that I asked. I asked them, can they explain to me what their definition of integrity is? You'll be surprised on some of the answers that I get back, because some people don't really think about, nursing as integrity being a factor, and it really is. The other thing that I do ask them about is their mental health, the self-care. What self-care do they do in stressful situations, anxiety? What type of wellness do they offer themselves in order to alleviate that? Because this nursing profession is highly stressful. So you do have to be able to take care of yourself, not just physically, but also mentally.
Yeah. So I'm glad you said that. So in terms of self-care, what kinds of things are important to you, in your life and work as not only a nurse, but also a nursing educator and administrator? And what kinds of things do you point, your students to consider to take care of themselves?
So for me, I definitely will, if I feel like I need to take a mental health day, then I'll take one. I don't let things spiral out of control to where it starts affecting my performance as a nurse educator and a nurse leader. And then also for the students, we offer counseling. We have Well Connect for them, but I have it to where our faculty provides an additional cushion of support for them, kind of like a calming type of atmosphere. If we notice that our students is going through something, or that they may be experiencing something that is really causing a lot of stress, I definitely will pull them in. I'll have the conversation with them. If I need to refer them out to someone, I do in that moment. So we are really empathetic when it comes to the students and dealing with their mental wellness. We take that very seriously. I take it very seriously, because I do understand that as a student, you do have to balance life and work and school. And a lot of times they don't have the proper support and or resources to do that.
Yeah. Yeah, and nursing is such a challenging profession, just from my observations of nurses. And you all work some long hours. So do you advise students to stay physically fit as well? Go to the gym, work out, because they got to be able to go stay on their feet for like 12 hours sometimes.
Well, here in our nursing program, they have to do, let me just say that we we prepare them for the real world as it pertains to their nursing practice. So when they do clinicals, they're doing the same hours that they would do if they were working as an actual licensed nurse. So, but we do, when they come in, even before they start the program, we talk about making sure that you take care of yourself, making sure that you're eating right, make sure that you're staying hydrated, make sure you're getting rest. And so there does have to be a balance there with that. And so I'll give some examples to them, as far as what a typical schedule would look like week to week for the nursing program, and then some tips and tools on how they can work around that. Because I know that they also have families. They have a husband, or they have kids, or both, or some may have be a military spouse. And so the dynamics are different, but that's not to say that they can't manage their time well enough to where they're able to perform and demonstrate the way they need to.
Yeah. So when someone, shows up in a doctor's office or a hospital, even urgent care, whatnot, they're usually sick or feeling bad about something. So here's my question to you, Dr. Armstrong. How can patients protect their health? What can we do to practice self-care in terms of staying as healthy as we can? Even though I realize, though, that people do get sick. It's just the nature of the human organism. But how can we be healthier?
That is a really good question. And I'm glad you asked that question. Being proactive, not reactive. Meaning, a lot of times, and a lot of the biggest thing that really is kind of a snowball effect is, maintaining routine doctor's visits, getting that preventative care at a lot of our local, the health department, some of the clinics, some of the drugstores that we have around here, like CVS, Pharma's, CVS, Rite Aid, Walgreens, et cetera. And then I think the biggest thing is really knowing what's going on with you and being proactive about it, to get checked up, to, if there's medication prescribed, to make sure you're taking your medication. I do understand that, a large portion of our population, may not have health care, may not be able to afford medications. That has been an ongoing issue. However, there are resources available in order to help with that. And then you also have some physician offices that may have samples at the office, in order to kind of help with the cost. So that's just something that you will have to ask about, in the event that you're not able to purchase that particular medication at the time. There's a lot of nonprofit organizations that also help assist, with vaccinations, immunizations, things of that nature. The community health fairs that are being offered throughout, Virginia, it's a matter of attending. You'd be surprised how much free available resources are there. Everything from housing to clothing to food to immunizations to blood pressure checks. The list can go on. But just knowing where you're at from a health standpoint, and then taking the corrective action, and then the follow-up. So it's not just finding out what's going on with you, but the follow-up part of it, to continue to get followed up on your care.
Yeah, maintaining my health is my responsibility. And of course, I enlist the doctors and the nurses to help me take care of my health. Does that sound a little right, or am I far-fetched here?
No, actually, you're absolutely right. A lot of times, we will say when we're sitting there in front of the doctor, yes, I'll do X, Y, Z. But then once you get home and you're in your comfort zone, you kind of fall back into that same routine. And then, of course, you're not checking your blood pressure, you're not doing your glucose checks, or you're not eating that diabetic diet that you're supposed to be eating. You're eating fried foods and things like that. And so once that happens, then here we are. It's kind of like a cycle, right? That doesn't get broken. But individuals need to understand that you are the one that can break the cycle by being proactive in maintaining your self-care.
Yeah, now you've mentioned nutrition and what we eat a couple of times. So let me ask you this. So what's the role of nutrition in our health? I mean, is that because most people think that, heck, I eat what I eat and it doesn't really matter, but does it matter, Dr. Armstrong?
It does matter. Let me just put it like this, you don't gain weight just all of a sudden. You don't develop, heart disease all of a sudden. You don't develop high blood pressure all of a sudden. This happens over periods of time, right? By you not eating the proper foods, or you're eating really foods high in cholesterol, or fried foods, or a lot of, sodas and things like that. And so over a period of time, your body makes the adjustment, but as it's making the adjustment, it also starts damaging, right, your cardiovascular system, your renal system, and those other aspects. And so by the time that you get to a place to where, okay, well, nothing's happened to me yet, well, then here you have all of these things that are now surfacing, like the signs and symptoms of the high blood pressure and the cardiovascular disease, like heart failure, some renal problems. This is why, this is the end result from all these years that you have been not maintaining your nutrition and or health. And so I tell individuals when they're young, you really need to take care of yourself now versus later, and not assume that by the time you get 35 or 40, that you're going to be in the best of health.
Yeah, what I hear you say is that lifestyle plays a role, an important role in our health. Yeah. So, and this includes, what we eat, and sleep and those kinds of things. Okay. So now you also work with students, and I know you are definitely deeply involved with students. How do you all at your school and the programs you've worked with recruit students? What goes into recruiting students for nursing?
Oh, wow. I can say we have lunch and learns, where you actually will come in and we provide lunch and you learn about the different programs, the different career aspects at our college. We also do career fairs where we may end up going to some of our facilities, such as Centera or Chesapeake Regional, and we may provide, information about our nursing program. And then we also have commercials that are played, on Wavy 10 and maybe some other channels that talks about our nursing program, and also by word of mouth. We have our graduates that after they graduate, they do work out in the community. And they do get approached, from, let's say, some care partners or individuals that are not licensed professionals, asking about the nursing program, what school they went to. And so we get it from all aspects.
Right. I also noticed, as I reviewed you, that you work with low-income nursing students. I mean, sometimes people shy away from people who may be in that low-income category, but you seem to gravitate toward working with students regardless of their backgrounds. Tell me about that.
Oh, absolutely. Everyone, I don't think that anyone should be stereotyped or put in a category to say, well, only these type of individuals can apply or, become a nurse. I have crossed paths with many nursing students that I have taught, and also, have led under my leadership that are phenomenal nurses at this point. I can say that I think it would be a really, really good equitable learning experience in order to assist or further assist these individuals to achieve their goal of completing a degree, number one, but also preparing them to take their NCLEX to become licensed and being my colleague. I always kind of give that to them to let them know, the world is yours, but you also have a responsibility or obligation to do your part. And a lot of times, these particular students, they do come and they do ask, well, I think I may have a situation with this that may prevent me from achieving my goal. And I'll talk about the different barriers, but I always tell them, if you foresee this, come talk to me so I can identify what it is I can help you with and what it is I can help you to achieve and get you where you need to be. So we don't shy away from those in those type of students or those individual students. Actually, I welcome them because they have just as much opportunity as anyone else, if not more.
So in the programs, the nursing programs that you've worked in over the years, do those programs have the, let's say, philosophy of, if we bring you in, we're going to work with you to get you out successfully, including passing the exam for the RN? Is that, do nursing programs have that type of philosophy? Or is it something like, you're a professional, sink or swim?
I can tell you now, I'm only going to speak for myself here when I say this. The college where I am currently at, yes, we do have that philosophy. And as a matter of fact, I have included in or implemented an additional support for students post-graduation. Now, I can say I have not seen that anywhere else.
I see. Now, I want to turn now just a little bit to diversity in healthcare, because I know that this is a passion of yours. I could have that wrong, but is that right?
No,
Diversity.
you're right.
Okay. I saw something today across LinkedIn, and I didn't fact check it. And they were talking just about medical doctors, and there's someone who's trying to change those numbers. They said something like only 5% of people of, African ancestry, or Black Americans specifically, are medical doctors. I don't know what the percentage is like in nursing, but is it a low percentage of people who happens to be of Black American heritage who are in nursing? What are those numbers like?
Yeah, actually that has increased.
Okay.
I'm seeing more African American applying to nursing programs, and seeing a few more males as well. And speaking that, the nursing profession was generally a predominantly, Caucasian field. But since over the years, like I said, as healthcare has changed and also as the face of nursing education is changing, I am seeing more diversity coming into the nursing programs.
Yeah,
Absolutely.
we patients are the beneficiaries for sure. You mentioned male nurses. Why is that important, do you think, to have men work as nurses, especially as RNs?
Mhm. I think as male nurses, it encompasses how can I say, a different level when it comes to nursing, right? Because when we look at nurses, we look at female, we look at, the soft-spoken, the caring, the compassion, right? Coming from a woman, right? But men can do that as well. And I just think that adds a little something extra, having a male nurse and or bringing males into the profession to provide that same compassion, caring, warmth that patients need, and the quality of care as well.
Yeah, I guess if you talk about the face of nursing, society consists of both, sexes, so nursing can look like society in that area as well. Yeah,
Absolutely.
I want to go back to nutrition. I'm not sure, if you have a favorite, nutrition plan or not, but just thinking about nutrition, what people eat, what kinds of plans have you heard of, and which, one that may appeal to you the most?
I think one of the ones that appealed to me the most, because I actually did this as one of my evidence-based practice projects when I was in my doctoral program, is the ADA, the American Diabetes Association. They actually offer day-to-day meal plans, based on your weight, also how many calories a day. And, it incorporates, the 4 food groups, as well as what these food groups look like. They differentiate it. they basically teach you about the different types of food, because all fruit are not good. You know, you have some fruit that contains more sugar. You know what I'm saying? And so for a
Yeah.
diabetic patient, they may not be able to eat this particular fruit. And so it's things like that that can educate a person in order to make the change or make the adjustment to their diet or to their nutrition to do a little bit more as far as preparing and planning. Now I get it, you know, with the rise in inflation and the cost of food nowadays and meals. You know, the other alternative is, you know, farming, you know, having a little something in your backyard to where you're growing these fruits and vegetables and things like that. Sometimes that may be more cost effective than the grocery store, you know.
Yeah.
But for that, to answer your question, I really do like the American Diabetes Association. The plans are simple. They do breakfast, lunch, and dinner menu to where you can build it specific to you. And they also have recipes. They have a lot of recipes that you actually can do and cook with.
I love that. You know, I just hear you say that we do have some power. We may not have ultimate power to improve our situation, but we do have some power. Now, you know, you do a lot of ceremonies for graduates. I think it's called, help me if I get it wrong, the pinning ceremony for
Yes.
new nurses. As a, you know, as a person who has been an administrator and a nurse, you know, professor, what is that like to see a group of students who came through and then they're being pinned, you know, as nurses? What is that like?
That for me is the moment for me that I'm like truly elated at the fact that, you know, they started from sitting in the seat, you know, in orientation to now they're here sitting in the seat to become my colleague. And that's truly a blessing, because a lot of students don't make it to that seat. You understand what I'm saying?
Yeah.
And it's a rite of passage into the nursing profession. It is a rite of passage as they take the nurse's oath. And you know, they also get recognized for their accomplishments. You know, we also identify those that excel in clinical or those that have excelled academically. So we do recognize them for that as well. And then they also have the opportunity to, you know, to voice and write their sentiments, you know, and their acknowledgments for those that have really been in their corner to help them get through.
That's fantastic. Yeah, you know, the few times, I don't like going to hospitals, but whenever I visited a hospital or even some doctor's offices, I see what I'm going to call toys, all of these gadgets, you know, that stuff for the MRIs and all kind of scans. I'm thinking, whoa, boy, that's a lot of stuff to play with. So what are some of those tools that, you know, that you all work with? Give us maybe two or three of them. And what would you tell a young person about some hands-on things they could do as nurses or even as Dr. Armstrong, as technicians?
Right. So in our program, we have skills lab, and hence the word skills. And so there's certain skills that are required for a nurse for us to be able to perform and do at a competency level. And so while they're here in the program, we actually train them for that. And so they start from the very bottom of changing a bed to bathing a patient, to putting and changing wound dressing, a wound vac, being able to put SCDs, which are compression devices, on a patient, knowing what that machine looks like, an IV pump, infusion pump, how to set it up, how to be able to calculate the drips, also administering a blood transfusion, being able to practice venipuncture, being able to start IVs on a patient. These are just some of the skills. We also teach them how to insert in a nasal gastric tube, how to remove one, how to take care of a central line dressing. I mean, there's quite a few skills in addition to them learning while they're in class. But even when they go to clinical, they get their hands on doing more skills at that point. And so the door is wide open for that, for them to get as much as they can prior to them finishing the program. Why is that? It's because I want to make sure that they are marketable when they leave here, and knowing and having that skill set under their belt, it will definitely make them more marketable for the industry.
Yeah, it seems that the entire nursing, just as an outsider, to me, it looks challenging to be a nurse. But there are two areas to me that just, oh my gosh, I just can't imagine working in those areas for me now. One is the ER, and the second is a surgery room. So my question to you is, how do you help a student who's about to graduate figure out what's the best spot for them? Is it ER? Is it surgery? Or is it a floor nurse? How do you figure this out?
Yep. So that's a good question. As the students go through our program, they are experiencing clinicals for each area. So they have clinicals that they do for med-surg, for maternity, OB, pediatrics, mental health, geriatrics, and then the list goes on. Once they get around semester 4, which is their junior level, we actually will start talking to them about what area they want to work. And then we set up a preceptorship for them. They actually get to use and or choose the unit that they would like to work in hopes of getting hired on once they graduate. So we kind of set them up while they're in seat with us, to put them in a better position to definitely be able to work that prior to them finishing. And I will say that a lot of our clinical partners, they do hire the students while they're still students, once they get to their senior level, getting ready to graduate. So that's a very, how can I say, interesting time for them, because with the preceptorship, they actually will work that particular unit they want to go to, and they are working the schedule that their preceptor's working. So they are actually getting on the job training, so to speak, to really prepare them for what it's going to be like. So it's kind of a win-win situation for them.
Fantastic. Look, I found a statement that you shared once. I would like to read it and then have you, just kind of unpack it for me and say a little more about what this meant when you said it. Is that okay with you?
Sure.
Okay, here it is. One of the things I love about having my Doctorate of Nursing Practice is that I get to see what's out there in a way that I couldn't with just my Master's of Science in Nursing. Because I can teach in a graduate program, a doctorate in nursing practice is also required for management positions. I consider myself a leader, very much so. Being able to do that, oh yes, that's a plus.
So I can say I have always, since I finished high school, even when I was in high school, I've been a leader. I like taking the lead. I like not necessarily giving orders, but I really do like having a purpose when it comes to facilitating and guiding individuals in a positive light. And I knew that this was my strength when I actually took my first teaching job back in 2007. I knew that this was a permanent for me when I took my first leadership position back in 2016. So with that being said, leadership, not tooting my own horn, I am good at it. My passion is teaching. That's what I love to do. But I have more joy out of knowing that I can improve and grow and develop and nurture others to be a leader as well. My expertise, my background, the things that I do, I share that with those who aspire to be a leader or be in some leadership position. And so that's why I say that it just really opened a whole nother door for me to be able to do that.
Mhm.
I wouldn't be where I am now had I not pursued my doctorate, because honestly, I really thought I was just going to stop at LPN,
Mhm.
but something told me to keep going because there's more that you can do for other people.
Mhm.
And so a lot of times I've learned so much being in this leadership role to where I'm at a place of, when you see an individual and just because they're not performing at the level you want them to, it may take you to provide them with those skills and with that education and with that knowledge and your expertise and background to get them there. I have been in several positions to where I've seen it to where, you know, some employers, they'll get rid of you if you're not performing at the level that they expect for you to. But I look at it from a different lens of, they may need, or you may need to tap into that talent of that individual and make sure that they're in the right place within that organization, because sometimes people are not in the right place within the organization, which is why they may not be performing well. But you also have to look at that. You can't just look at, well, I have you in this position, this is what I need for you to do in this position. But if that's not their talent or that's not their background or expertise, you're kind of at a loss, not just with that individual, but also within your organization, because the outcomes are not going to be what you want.
Mhm.
So for me as a leader, I'm able to provide that to others, to my faculty, to my staff, and even to other departments that I work with, you know, letting them see what it's like on this side of the fence for, nursing education. Because some programs, nursing education is on its own island. And so other departments may not know all the details and ins and outs as to how it functions in XYZ. But by being that leader that brings in everyone into the process and not just some people, I think you'll get a little bit further with what it is you want and the outcomes that you want to achieve.
Mhm. So as a leader, and you said that you were a leader, you were born a leader almost. What are, and let's isolate them to bullet points. What are 2 or 3 characteristics that make you say that you're good at it?
I am definitely an advocate. I advocate not just for myself, but also for my students. I'm very student-centered, because I was one. And then also I advocate for my faculty as well. I just don't leave them out of the picture. Um, I have to be very authentic when it comes to my leadership. I don't sugarcoat. I'm very transparent. I'm very clear about what it is I'm needing and wanting from you. And I also ask what it is you need and want from me. So that authenticity is important as a leader. It really is. And then another bullet point for me would definitely be my leadership style. I am definitely democratic when it comes to leadership. I like the feedback from individuals. I like their suggestions, their ideas, in order for me to get to the bottom of whatever it is we need to get to, whatever goals we need to reach. I like that collaborative teamwork. And so therefore, I include all into the process, not just me.
Fantastic. Well, Dr. Armstrong, is there anything else you care to share with us before we close today?
Yes, there is. For those who are in the position to where you want to walk away from nursing, I am going to challenge you to look at where you would most benefit, but not benefit but also be able to provide and get lost in the service of others to where you're able to give more than what you are now. I really want to challenge you to do that, because a lot of times we do get tired, we do get exhausted, we do get, kind of sidetracked on the day-to-day. And yes, we do want to just stop and just throw our hands up. But there is a greater purpose than yourself. Mm-hmm. And so I'm going to challenge you to identify what that is and for you to go for it, because it may not necessarily be where you are currently at.
Mm-hmm. I love it. Well, there you have it. Okay. Well, Dr. Armstrong, it has been my pleasure talking with you today. You clearly are a nurse educator and a leader in nursing for sure. So thank you for being with us today.
Thank you. Thank you for having me.
You've been listening to the Possibility Action Network podcast. I'm your host, Stephen Middleton. Our guest today has been Dr. Rita Armstrong. Until next time, good day. You are not alone, just keep